Hi, welcome to Medicare 101. My name is Larry Hurwitz. This is an educational seminar as opposed to a sales seminar. So we're not going to try to go ahead and lead you toward any specific carrier or any specific plan. I know it says Anthem Blue Cross on the first slide here. They were kind enough to provide me the slides for the educational video, but we're not going to talk about any of their specific plans. We're going to talk about what Medicare covers, what your options are. I think this is going to be really important to you, whether you're enrolling in Medicare for the first time, whether because you're turning 65, whether you're leaving an employer plan, whether you're thinking about leaving an employer plan, or whether you've had Medicare for a long time and you're wondering what your options are, whether that be going to a different Advantage plan or possibly whether it's possible for you to go into a supplement and whether that's something you can do. Every year the deductibles change, co-payments change, so this is going to be updated to 2018. I want to try to keep it on one hand simple for you guys because I know this information can be overwhelming, but on the other hand, for those who really want to know the details, we'll do a little bit of a deep dive, but most importantly, I just want everyone to know what's available, what they have, because it's unbelievable how many people have no idea what they have, whether they think they can go to certain doctors and they can't go to certain doctors. And it's unbelievable how many people are paying money for something that they shouldn't be paying money for. For example, Part B, and we're going to get to that in just a slide. But let's just move on. Real quick, I'll say the only thing that this covers, or doesn't cover, I should say, that if you were here in a live seminar with me would be the donuts and coffee. I want this to be interactive, and I want you to get your coffee at least, and maybe a water bottle. So if you listen to this seminar, call me or send me an email info@benefit packages, ask any questions, give me your comments, give me a call. We'll send you a Starbucks gift card for coffee or a water bottle. So let's go ahead and move on. What is Medicare? Medicare is a health insurance program for people who are 65 years old or older. If you're under 65 with certain disabilities, or if you have end-stage renal disease, those are the people that are eligible for Medicare. Flip on. Who runs Medicare? CMS, that's the Center for Medicaid Medicare Services. Social Security Administration actually enrolls most individuals. Or if you are a Railroad Retirement Board enrollee, you can enroll through the RRB. Medicare actually has 4 parts, A, B, C, and D. A is hospital, we'll get into that in just a minute on the slides. B is your medical. C is actually a Medicare Advantage plan, a different kind of Medicare. And D stands for drugs, is your prescription drug plan. This is an important slide because these are really the 2 different roads that you have when you're choosing a Medicare plan. Road 1 is original Medicare, and that would be your Part A, inpatient hospital. Part B is medical. Now, Part B, even though it's medical, that people think Part B medical is just outpatient. That even includes the doctors, surgeons, all that in the hospital as well. Step 2, decide if you're going to have original Medicare. Let's decide if you need to add drug coverage. In my opinion, you definitely want drug coverage, assuming that you are not on an employer health plan or other coverage. If you're going to enroll in Medicare, you want a Part D drug plan, even if you don't take prescription drugs, because if you don't get a drug plan, and I'll talk about that later when we get into the Part D drug plan slides, you will have a penalty that will last you forever. That's probably not something that you want. And if you also are going to want to have original Medicare, you're going to most likely want a supplement. Or another word for supplement is a Medigap policy, because it supplements or fills the gaps of original Medicare. Original Medicare, you're going to see your own doctor. It's going to give you that freedom of choice. It's going to cost money to buy a supplement. But for people who want the freedom of choice of doctors, are most likely, if they can afford the pricing of the supplement, are going to probably want to go in that direction. On the other hand, a Medicare Advantage plan has some great options. In Southern California, there's a ton of zero premium plans. In Northern California, they're still generally significantly cheaper than the supplements. They're going to be more managed control plans. Most of them are Medicare Advantage plans. Most of them are HMO plans. And most of them do include your Part D drug inclusive. They're known as an MAPD, Medicare Advantage Prescription Drug Plan. As per the slide, you cannot enroll in a Medicare Advantage plan and a supplement at the same time. So you either got to have your original Medicare, and then most likely you're going to want a Part D drug plan and a supplement. So if you have original Medicare, you're going to have your 3 cards: your Medicare card, your supplement card, and your prescription drug plan card. Or you're going to want to have your 1 card if you have a Medicare Advantage plan. That's going to be your card for the pharmacist, the doctors, and everything. So let's move on. Talking about enrollment in original Medicare. You can automatically enroll if you receive Social Security benefits. So if you get Social Security benefits, they're just going to go ahead and enroll you automatically. Or if you get railroad retirement benefits. Your initial enrollment period is mailed 3 months before you turn 65 or your 25th month of your disability, and includes your Medicare card. You can keep it and accept Medicare Part A and B, or return it and refuse Part B. So you can sign the back and say you don't want it. We'll talk about in a little while whether you would want it or not want it. Most likely the only reason you probably wouldn't want it is if you have insurance through work that's not costing you any money. As of April of this year, the new cards came out and cards are being replaced. So the old cards had your Social Security numbers on them, and they would have had an A at the end or a B or what have you. Now we're getting numbers for identity theft that do not include your Social Security numbers. So that's a good thing. If enrollment isn't automatic, you're going to go ahead proactively and enroll at socialsecurity.gov. You can also enroll at the Railroad Retirement Benefit if you're a railroad retiree, or you can go to medicare.gov. When you enroll in Medicare, you don't have to be retired. You can keep working. You have an initial enrollment period, that's IEP, that lasts 7 months. It begins the 3 months before you turn 65, includes the month you turn 65, and ends the 3 months after you turn 65. And then you can see there are other times you can enroll, but you'd have to pay a penalty. If you enroll the 3 months before you turn 65, you will be effective the first of the month of your birthday month. So for example, my birthday is May 3rd. So if I can enroll in February, March, or April, and I will be effective May 1st, the first of the month of my birthday. But if I waited to May, I'm not going to be eligible, I'm not going to be effective in June. I'm actually going to be in July, because I'm going to be enrolled a month late because I kind of waited a little late. Likely, so if I enroll in June, I'm not going to be enrolled until 2 months later, or July 3 months later. So you really want to enroll before your birthday month to be effective on the first of the month of your birthday. Deciding which plan is best for you. We have a stylish yoga lady. Her bracelets aren't getting in the way, and she's in full makeup looking great. Okay, let's see what she has to say. Original Medicare or Advantage plan? Should I take B? When? What about D? Do I need a Medicare supplement insurance policy? Let's figure it out. I talked about it a little bit in the earlier slides. A covers your hospital stays, your skilled nursing facilities, your hospice care, some home health care. But B covers your doctor services, and again, that would be in the hospital as well. Outpatient medical and surgical, clinical, lab, durable medical equipment, we call that DME, preventative services. So that's your original Medicare, Part A and Part B. That's original Medicare, okay? What does Part A cost? Well, most people get Part A for free because they paid into Medicare that's part of your payroll taxes that you paid your whole life. But you have to work at least 10 years, 40 quarters to qualify for your free Part A. Or if you are married to someone, you can qualify under their working record. If you've been married for at least a year and you're still married, you can qualify for your partner's Part A. If you're divorced and you've been married at least 10 years, you can qualify under their Part A. Now, if you haven't worked 10 years, you can still get Part A, but you got to pay for it. If you worked less than 30 quarters, it's going to cost you $422 a month. And if you work between 30 and 39 quarters, it's going to cost you $232 a month. So that's something you could pay for. Every year you don't take Part A, that it's available for you to buy, you're going to get penalized 10%. So it's kind of depending on your situation. It could be a catch-22. That's why you want to talk to somebody who kind of can steer you, like benefit packages or another knowledgeable agent that you feel comfortable with. How does Medicare work? What does Medicare pay for if you just had original Medicare? Well, they go by benefit periods for under your Part A, under hospital. Days 1 to 60, you have a $1,340 deductible. 61 to 90, $355 deductible. And you can see what happens from there. Just to clarify, the benefit period for Part A is 60 days. So if I went to the hospital, I was released, didn't go back to the hospital for 60 days and went again, I would have another $1,340 deductible. Now your Part B with Medicare, it's going to be a calendar year. So that can be confusing. Your Part A is a benefit period for 60 days. Your Part B is a deductible per year. Also keep in mind that you can see on this slide, if you've ever exhausted your 60-day lifetime reserve, and that's over your whole life, you have no benefits under original Medicare. And I said in my presentation a couple years ago, I don't know about you, but after 90 days, I don't quite know if I want someone to kick me out of the hospital. I'm not saying you'd be kicked out of the hospital, but I wouldn't want to take any chances of any problems. What about your skilled nursing facility? You pay 0 with original Medicare, 21 to 100 days, $167.50, no coverage after 100 days. And to qualify for skilled nursing, you have to have been hospitalized for the last 3 days, or at least hospitalized at least 3 days and admitted to an SNF within 30 days of release. Do I need to sign up for Part A? No, you don't need to sign up for Part A. And again, it's premium free for most people, as we already discussed. But really, the only reason you probably wouldn't want to sign up for Part A is if you have a health savings account at work. Because even if you have a work plan, and there's no reason not to have Medicare Part A, but you can't contribute to your health savings account if you have a Medicare Part A. But besides that, there's probably not a reason to sign up with Part A. Part B is another reason not to possibly sign up, because Part B is going to cost you money. And again, you need to do a cost-benefit analysis and say, hey, how much is it coming out of my paycheck at work for my insurance? A lot of people have no idea how much they're paying. And if it's you and your spouse, find out how much it would be just for your portion. Most companies nowadays pay 75 to 100% for the employee and very little, if anything, for the dependent. If you're the dependent, whatever that payroll deduction might be, it might be almost everything. So might be a huge savings on your payroll deduction if you jettisoned yourself off your employer plan and got on Medicare. Your Part B, if you're the average person's income, which is $85,000 or less for an individual, or $170,000 or less on your joint return, is $134 per month for your Part B. But you can see as your income becomes higher, or is higher, you're going to pay what's known as an IRMA. It stands for an income-related modified adjustment amount. And you can see it tops out if you are over $214,000 for a single, or over $428,000 for a couple. Then your Part B premium, instead of the $134, would actually be $428.60 a month. So if you're at that IRMA level and you're still working, that might be another consideration possibly to stay on your work plan. Again, you'd have to weigh the benefits and the pricing and all that. If you have original Medicare, you'd be responsible for, this is again a calendar year deductible, $183, and 20% coinsurance for most services. Also, this slide doesn't reference it, but there's also a possibility you'd have to pay not only the 20%, you possibly could pay an additional 15%. That's called excess charges, because doctors who accept Medicare either accept Medicare assignment or they do not accept Medicare assignment. If they do not accept Medicare assignment, they can charge you up to 15% more than the Medicare allowable amount. And some of the better supplements that we're going to talk about in a minute, like Plan F or Plan G, they pick up that 15% excess charge. Should I keep my Part B? Again, automatic Social Security retirement benefits. Most people pay a monthly premium. And again, if you're gonna stay on your work plan, if you've determined that you want to stay at your work plan, don't pay for Part B. Remember that card slide, sign it and send it back. I have talked to so many people that are 70 years old, 75 years old, paid for Part B for 5 to 10 years, thousands of dollars, and they were on their work plan for nothing. People think, well, they can't get Part B if they don't get it later on. Yes, you can. You qualify for a special enrollment period. We'll talk about that later. It's called an SEP. You have 8 months if you leave your work plan to sign up for Part B without a penalty. So if you're not going to use it and if you're going to stay on your work plan, refuse it or call me to confirm that. Should I keep or sign up for Part B? If you want a Medicare supplement policy or a Medicare Advantage plan, you have to have Part B. It's not optional. If you're eligible for TRICARE, which is folks in the military, and depending on your situation with your employer, a lot of times more unions or retiree plans, it's possible they might require that you have it. Should I keep or sign up for my Part B? What does delaying Part B mean? It means possibly higher premiums. Again, that's assuming you don't qualify for a special enrollment period like we talked about, leaving an employer plan within 8 months. But if you just decide, hey, I'm healthy, why do I want to pay for Part B? Every year you don't sign up for Part B is going to cost you 10% for the rest of your life. And you can't just sign up for Part B at any time. You would be signing up between January and March, and it wouldn't be taking effect until July. And again, every year you delay is another 10%. Should I join a Medicare Advantage plan? Okay, you have to have Part A and B to join. It has to offer comprehensive coverage. The great thing about Medicare Advantage plans is it has to offer at least equivalent benefits to original Medicare. Generally, they offer additional benefits, but what they all have is a maximum out of pocket. So what that means is original Medicare, like we were talking about, covers 80%. There's no stop loss, so you could be paying 20% forever, let alone the fact that Part D is not included with original Medicare, and Medicare Advantage plans, most of them include your Part D drug plan, so it's a less expensive way to get your drugs, as well as the protection of knowing that you're only going to be out a certain amount of money and getting additional coverage, whether it be gym memberships, dental, lots of different possibilities for additional coverage depending on the carrier. Now it looks like we're going to dive into Medicare Advantage Plan Part C, which is another word again for a Medicare Advantage plan. These are plans approved by Medicare. It's another way to get Medicare. It's run by private insurance companies. So unlike original Medicare, where Medicare, CMS pays your bills and the supplement picks up that 20% and possible excess and deductibles, the Medicare Advantage is primary. A lot of people think they have a Medicare supplement when in fact they have a Medicare Advantage plan. The insurance company is the determiner of benefits, unlike original Medicare. They're going to go ahead and coordinate your health care. Okay? That's how a Medicare Advantage plan works. Can I enroll in a Medicare Advantage plan? Okay, initial enrollment. You've got 3 months before you turn 65, the month you turn 65, and 3 months after. You must be entitled to Part A and Part B and reside in the plan service area. Now, Medicare Supplement, on the other hand, you've got 6 months, and we'll wait till we get into the Medicare Supplement slide. But you have less time on a Medicare Advantage plan. One good thing about a Medicare Advantage plan, when you first enroll in one, if you're not happy with it within the first year, you can opt out and get into a Medicare Supplement only during the first 12 months. After that, you cannot do that. So that's important to remember. Also, I like the fact where is if you leave the area, a lot of people might start at a Medicare Advantage plan. Maybe they want to go to certain doctors if they develop health issues and they can't. If you leave your plan service area, generally it's counties, you get another SEP, special enrollment period, that allows you not only to enroll in another Medicare Advantage plan, but would allow you to enroll in a Medicare Supplement plan. So that way you could go and see your own doctor. So that's good to know. If you have a Medicare Advantage plan now, and you're thinking about possibly moving down the road, you would be able to enroll into a Medicare, not only another Medicare Advantage plan possibly, but a Medicare Supplement as well. Only Medicare Advantage plans have the annual election period, October 15th through December 7th. A Medicare Supplement does not. So it's a good time to talk to your agent or go to Medicare.gov, put in your prescriptions, see if there is a different Medicare Advantage plan that has your drugs, because you might be taking an expensive drug that might be part of one Medicare Advantage formulary list and not part of another. That could be a bigger difference in whether one plan has a $5 copay for a specialist and another has a $10 copay plan. Also, look at your doctors. Look at all the extra benefits. Time to compare and contrast October 15th through December 7th. Don't be complacent, because I can tell you, just on when I run people's drug lists alone, switching one plan, whether it be a Medicare Advantage plan or a PDP plan, I've saved people thousands of dollars who take expensive drugs. So don't just sit on autopilot. Special enrollment period, we talked about some of the SEPs already, which was like leaving your work plan. If you qualify for financial assistance, it's called LIS, low income subsidy. That also gives you a special enrollment period. You can enroll in a Medicare Advantage plan. Again, these are private insurance companies, whether that be Anthem Blue Cross, Blue Shield, United Healthcare, AARP, what have you. You can enroll directly through the carrier. You can enroll through an independent agent like myself who represents all these carriers. You can go to Medicare.gov and put in your information, and you can enroll right online at Medicare.gov. Part D, again, that could be part of your Medicare Advantage or a straight Part D. Generally, if you're going to get a Medicare and a Medicare supplement, you're going to go with your standalone Part D, which again is purchased from private insurance companies. This was created by the Medicare Modernization and Prescription Drug Act. You're going to pay a relatively small portion or small premium, assuming you don't have a penalty, an IRMA based on high income, because it is subsidized through taxes as well. So just like even though you pay for your Part B, that's actually a very small portion of what the real cost is. It's optional. Different plans, again, have different formularies, so it's important that you run your drugs and see if it's covered under the formulary. You must have Part A and or Part B. You don't have to have A and B. You can have Part A or Part B. You must live in the planned service area. Can't live outside the U.S. Sorry, can't be incarcerated. You have to be actively enrolled to join. When can I enroll in Part D drug plan? During the 7-month initial enrollment period, the open enrollment period, which is annual, October 15th through December 7th, and then coverage would begin January 1st. And depending on your situation, there could be a special enrollment period available to you. Should I enroll in Part D? Well, it depends again what your situation is. If you have group insurance through your employer, most likely your drug plan is credible, so you won't be charged a late enrollment penalty when you enroll in it later when you leave the work plan. The average drug plan is about $32. They could be more or less depending on most likely whether it covers the deductible and the robustness of the formulary. But every year you don't enroll, you're going to have what's called a LEAP, a late enrollment penalty. And the way that works is that $35 I was mentioning, you're going to pay 1% per month for every year that you are late. So that would translate to about 35 cents. So it's just over $4 per year every year you do not have a Part D drug plan. So if I waited 3 years, $12, $13, what have you, I will have to add that on top of my premium and pay that for the rest of my life. So again, there are some very inexpensive drug plans. I would definitely proactively enroll in one, and make sure, especially if you take prescriptions that are expensive, run your drugs. It's not worth saving a couple dollars on a prescription drug plan, or even saying, hey, this plan picks up my deductible and this plan doesn't, to find out that your plan doesn't pay for that $200 a month prescription that you take. Joining a Part D drug plan, you can go to the Medicare.gov website, put in your prescriptions. Again, call my office. We'll do that for you. We'll make your life easy for you. What is a Medigap policy? We talked about this a little bit throughout the slideshow so far. It fills the gaps of original Medicare, sold by private companies. Often they're going to give you extra benefits like a gym membership, discounts. You can see any doctor that accepts Medicare. You don't need to go to your primary care doctor with original Medicare and a supplement and get referrals to see specialists. So people that are into that freedom and flexibility should definitely consider a Medigap policy. And again, there's no open enrollment or annual election period for a Medigap policy like a Medicare Advantage plan. So if you don't get that during your initial enrollment period, unless you qualify for a special enrollment period down the road, you might not ever be able to get a Medigap policy. All Medigap policies are standardized. Plan N through N is listed here. The most popular plans are going to be Plan F and Plan G. The only difference is Plan G does not pick up the $183 deductible for your Part B. Once you meet that, and again, that's an annual deductible, you're at the same place as Plan F. A lot of times people start with Plan F because a lot of the carriers give you a better discount if you start with Plan F, and then perhaps down the road you want to downgrade to Plan G. Especially if you find out that you're going to save $400 or $500 a year to have a deductible that's less than $200, then it might very well make sense to go to Plan G. A lot of people, again, want to get that initial enrollment discount with Plan F, so it's basically the same price at first. Start with Plan F. You might have heard that Plan F is not going to be available anymore. If you get Plan F, you're going to lose your Plan F. 2020, you've got a while. They won't be available anymore, but people who have their Plan Fs will be able to keep their Plan Fs. It just won't be available for new business after 2020. Do I need a Medigap policy? Again, maybe you need one right now, maybe you don't need one right now, but if you don't get one right now, you might not ever be able to get one. And that 20% plus possible excess charges do not have a maximum out of pocket. So it could be very expensive if you do not have a Medicare supplement, if you have original Medicare. I would advise you, if you don't have a supplement, to get a Medicare Advantage plan, to get you one or the other. That's something you're going to have to go ahead and discuss with your agent. Call me, do your research at camedicare.com. That's our website that's specifically devoted to seniors. It talks about all the different plans in detail and gives you a lot of great information. Or again, please call me, send me an email at info@benefitpackages. Be happy to go over your specific situation with you. How do I find the right Medigap policy for me? You can go to medicare.gov, you can call Medicare, email me, info@benefitpackages.com, or call me directly. The marketplace, now we're talking, I kind of referenced that earlier. This is for people under 65. Depending on your income, you might qualify for premium assistance based on your income, and you do not qualify for free Part A. Don't make the mistake of thinking that I'm getting all this premium assistance and I want to stay on this plan, because the bottom line is, if you are eligible for premium free Part A, that premium assistance isn't available to you. So you might get a very big surprise when you do your taxes to find out those thousands of dollars of premium assistance you got, you have to pay them back. So if you're getting marketplace insurance through Covered California, get off of it. Okay, there is help for people with limited income and resources. It's called Extra Help. You can get information on that through the government. You can also call our office. We can help you with that as well. Medicare and health insurance marketplace. Medicare isn't part of the marketplace. But again, like we referenced before, it's important whether if you don't qualify for premium free Part A, whether or not you're going to stay if you're getting premium assistance, or join later on Medicare, which there'll be a penalty for every year you don't enroll in Part A, which is 10%, and you got to double that for the amount of years you were eligible that you didn't get. So that is kind of important. Good idea you discuss that with somebody who really knows the ins and outs of the pros and cons of whether you stay with the marketplace or Medicare. But again, if you qualify for premium free Part A, then there's no way that you want to stay for your insurance or with your insurance with the marketplace. Now we're going to get into what are Medicare savings programs, Medicare costs, Medicare premiums, deductibles. This all has to do with qualifying for different government programs. For example, what we call here, the first one is a qualified Medicare beneficiary. We call that QAMB. If your income is married 1374, single 1025, you're going to get free Part A and B. But also what's so awesome about it, they're going to pay all your deductibles and your co-insurance and your co-pays. You're going to be in great shape with that. specified low-income Medicare beneficiary or QI, qualified individual, they're going to pay for your Part B premiums. And if you are a qualified disabled working individual, you can make quite a bit more money, and they will pay for your Part A premiums, $54.99. Extra Help helps pay your prescription drug costs. It not only helps pay your costs, it helps pay your copay and cost sharing. Now, we talked about prescriptions in the Part D slide, but I didn't kind of talk about your cost sharing in detail on that. I guess maybe because it's one good thing about, you've all heard about the donut hole. The donut hole is shrinking, so the different phases might not be as important as they used to be, but the bottom line is initially you're going to have a deductible, depending on the plan, up to $405. After that, you're going to have what's called the initial coverage level, where you're going to pay co-payments. Now, the lower co-payments will be for the lower tier drugs. The higher co-payments will be for the higher tier drugs. So Tier 1, for example, is preferred generic. Tier 2 is non-preferred generic. Tier 3 is preferred brand. Tier 4 is non-preferred brand. Now, you have that initial coverage level, which is $3,750 worth of drugs. Now, that's both what you pay and what the insurance company pays. Once that happens, then you're into what's called the coverage gap, or the donut hole that everyone's heard so much about. But nowadays, the donut hole probably is somewhere about the same price as the initial coverage level for your name brand drugs, because it's shrinking. During that donut hole, bottom line is you're going to pay about 35%. The insurance company pays 15%. And they're going to pass along that 50% discount that they get to you, and that's how that 100% goes. And it's important to know, because that 100% of that money, including the discount, and this is confusing for a lot of people, goes toward the amount of money, which is $5,000 to get until you get into what's called catastrophic coverage. And when you're in catastrophic coverage, the good thing is you're not going to pay any more than 5% of the name brand drug. So then you're really paying little. So you won't have to, bottom line, pay $5,000 out of your pocket to get into that catastrophic coverage, because again, that 50% discount goes toward getting there. I know that's a lot of information. Just to keep it simple, let's say it's all somewhere about the same, and the donut hole, as time goes by, is actually going to get even less. So that's the good news. It's getting better. What resources are available? Medicare.gov, SocialSecurity.gov, and Healthcare.gov. So I think we're winding down here. I'm just going to key points to remember. Medicare is a health insurance program. Doesn't cover all your healthcare costs. You have choices. There are programs. But don't make a mistake. Get the information. Hopefully this was information that you'll find important to you. Thank you so much for sharing this time with me. I know there's a lot of information. It can be overwhelming and confusing, but hopefully you got a little greater clarity. At least know what you have, know what you can have. Using our services doesn't cost you an extra penny. We're compensated from the insurance companies. We're here to provide you objective advice. We're here for you not only during this process, but to service your policy. If you have any issues, we're your advocate. We look forward to servicing you and helping you.